Another new idea, and it's not that new, but in orthopedics, new is 10 years, 15 years. Many of you have heard about hip resurfacing. Hip resurfacing has been promoted as an alternative, as better than hip replacements, better than the conventional hip replacement that I've described. One of the key design features, there are two key design features. One is that less bone is removed. This head is implanted over the top of your own bone, and the bearing surface is a metal ball against a metal cup. And metal-on-metal articulations are common in engineering. Every car, every crankshaft, every bicycle chain, every ball bearing is a metal-on-metal articulation. So engineering of metals bearing against metals is really well developed. Here's an X-ray of one in place. And the predominant feature is this preservation of the patient's own femoral bone and neck. Currently, there are three implants are approved by the FDA, and they're all in active use in America. And if you did an internet search today, you would find a ton of information about this, and you'd find a ton of salesmanship. The websites are unrestrained in their statements that this is a permanent hip replacement, that you can participate in any sport, that it's smaller surgery, it's faster recovery, there's less blood loss. And that is what everybody wants. Everybody would like less. They would want less of everything. In fact, some of that is true. It is certainly true that less bone is removed. What that means in the long term is still unclear. It's certainly true that the metal articulation would probably last 100 years, 200 years. You might be able to take it out of one person and put it into another person and let him go with it for a while. The downsides are that it's sort of old-style technology. We're cementing the head back onto the bone. We haven't really done that in conventional hip replacements for a long time. The metal-on-metal bearing, while it's excellent for wear, has a downside in that as metal wears against metal, metal particles are generated and free metal ions are generated. And so if you measure the blood concentration of chromium and cobalt in people after their resurfacing hip replacements, there are considerable elevations of those ions. What that means is not exactly clear, and the proponents of hip resurfacing would say, don't you worry your little head about it, everything will be fine. They've never been proven to be a source of trouble. Some of us, and I'm one of them, would say, yeah, but you haven't proven that it's okay, which is more important, not proving that it's bad or proving that it's okay. Those are two distinct things. In fact, there have been some adverse events in terms of loosening of the implants, painful implants, in about 5 to 7% of the patients who undergo resurfacing. So there are some problems.